Welcome to the Swine Leaders Live Podcast. Today, we're diving into a topic that sits at the intersection of animal health, regulation, and on-farm decision-making, veterinary compounding. Joining us is Dr. Brian Payne, Director, Commercial R&D Technical Service, who brings deep insight to the regulatory landscape and practical application of compounding within modern livestock systems. Brian, it's great to have you with us today.
Jim, it's great to be here. Always great to have a discussion.
You've done a great job at Veterinary Pharmaceutical Solutions. Now, as we dive into some of these questions, Brian, so the foundation, to begin at the foundation, how do you define veterinary compounding in today's regulatory environment? And what are the most common misunderstandings you see across the industry?
Sure. Veterinary compounding is a veterinarian's tool, one of the tools that they have for prescribing drugs. So they can prescribe FDA approved products, for example, and veterinary compounding goes one step further. When there's not a tool in the normal realm of pharmaceuticals for these veterinarians to use, they can prescribe compounding. What we do is through regulatory guidelines, such as through the FDA and through the boards of pharmacy, we follow these guidelines, manipulate an FDA approved product so that it can be further utilized in livestock.
So, from a compliance perspective, Brian, what should veterinarians and producers clearly understand about the legal and regulatory framework that governs veterinary compounding?
Sure. Let's start with the producers. What the producers need to know is that they have to work through their veterinarians and to get a prescription. This isn't something that they can just call distribution or go to the farm store. Work with your veterinarians. For veterinarians, they have the legal right to compound themselves. They have to follow all the same guidelines that us as a pharmacy does. Where most veterinarians prefer to do is to put a lot of that regulatory burden back on the pharmacy. So they have to make sure they have proper prescriptions. We take care of that as far as when they send it in, making sure that those are compliant. And then I talk about a couple regulations. This is kind of the boring stuff, but the very important part about it. So 21 CFR, this is really through the FDA, a set of regulations that make sure that we follow the steps in order to get from approved products all the way down to the decision to use a compounded product. AMDUCA in 1994 was a law that was supported by the AVMA, so the group of veterinarians, as well as livestock groups such as AASV, in saying we don't have enough FDA approved products to use in our animals. So it's a dearth of products to use. We need to be able to use extra labeling, and this allows us extra label or compounding.
So, what about the role of education? So, why must education, Brian, lead every conversation about compounding, particularly in modern livestock systems where health decisions carry operational, economic, and stewardship implications?
Sure. So we're in swine. We are, or whether it's cattle or poultry, we are making protein for somebody to consume.
Yeah.
The consumers don't have a choice of what goes into those animals, and so we have to take it on for judicious use, for sustainability within our own proteins. Why do I start with education and making sure that everyone's aware of it? Is that there is some confusion. We get questions sometimes: can you compound a drug that's flat out illegal to use? We say no, you can't do that. There are certain ways to compound, and you can destroy products by improper compounding. And so we educate. I'll give one example of one drug that people were compounding themselves, and they found out that it was, once they compounded, was 0 to 55% active. That's destroying the molecule, not getting the benefit from it. So the education on the proper steps to compound is extremely important.
So, what about practical application? In your experience, where does veterinary compounding provide meaningful value within livestock production? And where should practitioners approach its use with careful evaluation and professional judgment?
Sure. Lots to unpack there. A couple practical uses. One of the biggest ones would be non-steroidal anti-inflammatories. Regardless of what disease these pigs have, there is inflammation. And choosing the proper anti-inflammatory to go along with potentially antibiotics gets you a better outcome. There are some tools that were removed from access recently, aspirins, for example. And so they needed a different compound in order to take care of the inflammation for these animals. Meloxicam happens to be one of the very practical ways to do that. And so the only way to get in the United States today is through compounded. It can be a suspension for sows. It can be run through the drinking water for pigs. So that is one practical aspect.
So let's end on industry context, Brian. So AASV has already taken place, and then the World Pork Expo is coming up in June. What key conversations are you hearing about regulation, stewardship, innovation, and how does responsible veterinary compounding fit into the broader industry discussions?
Sure. Stewardship, we keep hearing about making sure that antibiotics are used properly. I think that there's a full realization that they need to be utilized in livestock production, but we need to be responsible with them. So in those discussions that I have, we do have compounded antibiotics. We talk about how to use them responsibly. How do we walk down the decision tree of Amduca in order to get to compounding? Sometimes we can't, and they should be using a product that's higher up on it. That's our responsibility to further educate and have those discussions. I think as well as I mentioned earlier about inflammation, we are continuing to do more and more research with inflammation and finding that controlling inflammation has sometimes equal or even more value than providing an antibiotic. So that's judicious use, that's sustainability, and that's taking care of not only the pocketbook for the producers by reducing some of those drug costs, but it's also reducing the amount of antibiotics that we may have to put into the animals.
Brian, really appreciate your time and perspective today. This is a topic that requires clarity, responsibility, and ongoing conversation, and your insights help bring that forward. Thanks again for joining us.
Absolutely. Thanks, Jim.